Hello everyone, now let us discuss about CPT coding guidelines for medicine part 3. In the current session, we will be discussing about immunizations. Coming to immunizations, whenever we report vaccine immunization, first you must report the administration codes, which come under the category 904602, 90474. Here you can see the admin codes come under the category 904602, 90474. Admin codes must be coded along with vaccine and toxoid product codes. There are different product codes for each particular vaccine. First you need to code the admin code followed by product code. And coming to the guidelines for coding 90460-461 and 90471 and 90474. The codes 90460 and 461 are majorly pediatric codes. The codes are based on age, and the age of the patient must be 18 years or less than or equal to 18 years. And one more important factor is whenever we assign 90460 and 90461, physician counseling is must and should. The code criteria selection is based on age of the patient, whether physician counseling has been provided or not, route of administration, and then code for each vaccine or each component of the vaccine. We will code each component also. Some vaccines will have 3 or more components. In that case, you need to code for each component also. These are the 3 factors. Age must be less than 18 years, less than or equal to 18 years. Physician counseling is must. And then you need to code each component of each vaccine. When we come to 90471 to 90474, these are majorly adult codes. Any age. These codes can be given for pediatrics also. Whenever physician counseling is not there. For a pediatric patient, if the physician counseling is not provided, you need to code 90471 to 90474 series, not 90460 and 461. 90460 and 90461 must be coded only when physician counseling is there. So the coding criteria for 90471 to 90474 is any age, no need of counseling, and you need to code for each vaccine. Here, each component is not required. For even 2 or more components, you will code only for each vaccine, not for the component of a particular vaccine. Now let us discuss 90460 and 90461 description. 90461 is an add-on code and must be coded for each additional vaccine or toxoid component administered. It must be either coded for each additional vaccine or for additional component. And whenever we code 90460, the description of 90460 is immunization administration through 18 years of age via any route of administration with the counseling. In the code description itself, counseling has been provided. With counseling by physician or other qualified healthcare professional. First or only component of each vaccine or toxoid administered. For the first component, if there is only component for the vaccine. For the first component, you need to code 90460. For example, if there are 3 components in a particular vaccine. For the first component, you will code 90460 followed by 2 units of 90461 for the additional 2 components. So total, they make up to 3 components. For the first component, you will code 90460. For the additional components, you will code 90461. 2 units of 90461. Coming to the description of 90461, you can see each additional vaccine. Immunization administration through 18 years of age via any route of administration with the counseling by physician or other qualified healthcare professional. Then each additional vaccine or toxoid component administered. Under it, you can find a note, use 90460 for each vaccine administered. For vaccine with multiple components, that is combination vaccine, report 90460 in conjunction with 90461 for each additional component in a given vaccine. Now coming to the description of 90471 and 90472, 90473 and 90474. 90472 and 474 are add-on codes. First of all, let us see the description of 90471. It indicates immunization administration including percutaneous, intradermal, subcutaneous, intramuscular for all these routes of administration for the first vaccine. You need to code 90471. For each additional vaccine, you need to code this add-on code. Each additional vaccine and the route of administration must be either percutaneous, intradermal, subcutaneous or intramuscular. Then you use the add-on code 90472. Next is 90473. Immunization administration by intranasal or oral route. One vaccine. For intranasal or oral route, the primary code is 90473 and the add-on code is 90474 for each additional vaccine. Now let us see some of the examples for 90460 and 461. If suppose there is only one vaccine and no components, then only one code is sufficient, 90460. If there is one vaccine with three components that we have discussed earlier, so first you need to code 90460 followed by 2 units of 90461. For 3 different vaccines, in that case you need to code for each vaccine. For each vaccine you will code 90460, 3 units of 90460. Next, coming to another example, 3 vaccines are given and the first vaccine has no components. For that case you will code 90460 and the second vaccine has 4 components. For that you will code 90460 for the first component of second vaccine followed by 3 units for the remaining 3 components of second vaccine, 3 units of 90461. And the third vaccine also doesn't has any components. For that case also you will code 1 unit of 90460. So here total of 3 units of 90460 and 3 units of 90461 must be coded. Now let us see one more example. 4 vaccines are given to a 4-year-old patient along with physician face-to-face counseling. So the first vaccine does not have any components. For that you will code 90460. And the second vaccine has 5 components. For that you will use 90460 for the first component of second vaccine followed by 4 units of 90461. And the third vaccine does not have any components. For that you will code 90460, 1 unit of 90460. Coming to the fourth vaccine, it has 2 components. So for first component of fourth vaccine, you will code 90460. And for the second component of fourth vaccine, you will code 90461. So in this example, total 4 units of 90460 followed by 5 units of 90461 must be coded. A 20 years old patient presents for vaccine administration and the physician administered 2 vaccines, hepatitis A vaccine and Pneumovax 23 vaccine intravenously. What are the codes? Here 2 vaccines are administered and the age of the patient is 20 years and physician counseling is not there. So you need to go for 90471 series. So for first vaccine, you will code 90471 admin code followed by the product code 90732. And for second vaccine, you will use the add-on code admin code plus 90472 followed by product code of the vaccine 90632. If you see the product code description, 90632 indicates hepatitis A vaccine adult dose for intramuscular use. Whereas 90732 indicates pneumococcal polysaccharide vaccine 23 valent. Here you can see Pneumovac 23, which is nothing but 23 valent adult or immunosuppressed patient dosage when administered to individuals 2 years or older for subcutaneous or intramuscular use. So for every vaccine you will code the admin code followed by the product code. And if the patient age is greater than 18 years, greater than 18 years, and if there is no physician counseling, you must use the series 904712 to 474. 90471 is used in this case because the vaccine is administered intravenously. If the vaccine is given orally or intranasally, then you will quote 90473 and 474 series. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.